So I'm going to call on next on Dr. Christopher Rutty. I'm very pleased to introduce him. Christopher is an adjunct professor in health sciences at the Dell Atlanta School of Public Health at the University of Toronto. He is a professional historian with broad interests in medicine, public health, infectious disease, and biotechnology. He received his PhD under the direction of Michael Bliss. You can just see the influence of Bliss again and again. And his thesis was on the history of poliomyelitis in Canada, which he has written about very well. Chris has been very involved in many of the recent insulin historical projects, including curating his exhibits, working as the lead historian for the Defining Moments in Canadian Insulin 100 project. And he is now going to speak on Charles Best, the making and spread of insulin. I introduce you, Chris Rutty.
Thank you very much, John. It's great to be here. It's my first time across the pond, as it were, for my wife and I. We've been all over North America, but never been off of it. So anyway, it's great to be here. Appreciate the ability to come. Okay, so Charles Best, and actually the revised title is Charles Best and the Making of Insulin. Let's try to keep it more focused on that part of it. So let me see if I can see everything. Okay. Okay. So on October 26, 1923, Charles Best received a telegram from Fred Banting. Quote, "Nobel trustees have conferred prize on MacLeod and me. You are with me in my share always." Best was in Boston, invited by Harvard Medical School students to give a talk about the discovery of insulin, and to lend his name to efforts to raise $900,000 for a new dormitory. Best was introduced by Dr. Elliot P. Jocelyn, one of the leading diabetes specialists at the time. So it's one of the telegrams. After Best's talk, Jocelyn read a telegram, which is what we see here, he received from Banting. Quote, "I assign to Best equal share discover insulin. Hurt that Nobel trustees did not so acknowledge him. We'll share with him. Please read this telegram at any dinner or meeting, Banting." And it's a little reply, a telegram from Jocelyn to Banting, noting that it was the newspapers that picked up the story. The Boston Globe reported on the story of Banting wanting to share the Nobel Prize with Best, who was, quote, "now the most famous medical student in the world." Whether Best deserved the Nobel Prize alongside Banting and MacLeod, or in place of MacLeod, as Banting believed, can be debated, certainly. Nominations for the Nobel Prize had to be submitted during the fall of 1922, by which time Best's most important role in the insulin story, his persistent leadership in the practical and problem-solving aspects of the development and large-scale production of insulin, was becoming increasingly apparent. While Banting was most comfortable with patients in the clinic and Collins worked best in the lab on his own, and MacLeod acted as impresario in the insulin opera, as I like to call it, it was Best who played the critical role of doing the heavy lifting to ensure the best possible insulin was produced and made available. Charles Herbert Best was born on February 27, 1899 in West Pembroke, Maine, to Herbert Best and Luella Fisher, both of whom grew up in Nova Scotia. They met in New York City, where Herbert Best earned his MD. They married and moved to Maine, where Dr. Herbert Best began a long career as a busy country doctor along the state's northern international border with New Brunswick. As a young boy, Charles and his father often discussed medical lore, and during the last 2 years of high school, they perused medical school catalogs. The choice of Toronto was based on Charles's preference for city life, and because he could stay with relatives there. Another factor that focused Best's medical interest and towards physiology was an awareness of the problem of diabetes. His father's sister, Anna, had trained as a nurse in Boston and developed diabetes in 1913. She sought treatment at Jocelyn's Diabetes Clinic. Her deteriorating condition and eventual death on May 24, 1917 left a deep impression on Best. Best had made his way to Toronto a year and a half earlier and stayed with his father's sister, another sister of his father's, while he took several high school courses before entering the University of Toronto in the fall of 1916. Best transferred into the physiology and biochemistry program a year later. He also felt a strong call to enlist, and in the spring of 1918 joined the 70th Battery of the Horse Artillery and was sent to Camp Petawawa near Ottawa. In August 1918, Best returned home, accompanied by Clark Noble, with whom he had made friends in the physiology and biochemistry program. 2 months later, he left for England as part of the 2nd Canadian Tank Battalion, but his timing was poor, as not long after he arrived, the war ended, and he was quickly on his way back home. In February 1919, Best met Margaret Mahon, and they soon became inseparable. And on July 12, 1920, they were engaged. During Best's 4th year in 1920-21, he and Noble worked together as demonstrators while also undertaking a research project involving inducing diabetes in turtles, based on Professor J.J.R. McLeod's interest in exploring the relationship of the brain and nervous system and carbohydrate metabolism. This research introduced Best to the latest methods for estimating sugar in small blood samples. In mid-May 1921, McLeod introduced Banting to Best and Noble, and also showed them the small operating room in the physiology department where they would begin their work in this particular building, the medical building at U of T. Quite a modern facility for its time. It was built in 1903, had very flexible labs, very on par with similar buildings at Harvard and Johns Hopkins at the time. He also left it to Best and Noble to determine who would work first with Banting, and Best won in a deciding coin toss. He wrote his final exam for his physiology and biochemistry BA on May 16th, and on the next morning met Banting in the operating room. The initial work was frustrating for Banting and Best, and the relationship grew tense. While Best took time off for militia duty and to see Margaret, Banting saw sloppy work and a messy lab and a lack of discipline. Although they almost came to blows, Best stayed calm, took the criticism in stride, and spent the next night getting the lab spick and span. As Banting wrote, "We understood each other much better after this encounter." By November 1921, when it was time for Banting and Best to give their first report on their work, it was Best who drafted the paper. He relied on Margaret to carefully write it out by hand while he dictated. You can note at the top of the one on the left there, that's some of that describes how that happened. Well, much has been written about Best's work with Banting during the summer and fall of 1921 into 1922, especially by historian Michael Bliss. Although 7 years younger, Best was the more stable, grounded, and practical of the two, and played a peacemaker role when tensions between Banting and Collett boiled over in late January 1922. He also lent Banting a hand in March 1922, drawing him out of a drink-induced depression amidst a breakdown in the Connaught Laboratory's insulin production and Banting's feelings of isolation from the work. However, the nature of the work and the different roles led to a drifting apart. Banting was increasingly focused on clinical work, while Best managed Connaught's insulin production operations and collaboration with Eli Lilly. Best also maintained a closer working relationship with McLeod, while Banting largely avoided him. Best was also committed to completing a master's degree under McLeod's supervision so he could enroll in medical school in September 1922. The extract production work at Connaught Labs began in mid-February 1922, shortly after the first successful trial of Culp's extract that took place in the basement of the medical building. So Connaught Labs was a vital part of the University of Toronto. I've done a lot of work with them over the years, and they were ideally situated. I've played a huge role in this whole story. That's otherwise not talked about as much, but anyway. Best wrote to his father, "We have our new lab, fairly well completed," as he wrote to his father. "We began work yesterday afternoon, but one of the stills blew up at the first trial, and so we are held up again temporarily. It was a disconcerting event. Extract production at Connaught would falter, leading to a 2-month famine. The meager amounts that could be produced contributed to the death of a young girl who was a friend of Best's. She had fallen into a diabetic coma and was revived, but she died when the extract ran out. Although considerable progress was made in restoring production by May 10th, led primarily by Best, the sense of teamwork had broken down, at least as far as Collip was concerned. As Best outlined that day in a letter to his father, quote, "There has been a lot of trouble and quarrels, etc., but we are getting on. Collip has not played fair. He was in charge of making the extract. Banting and I were going along with the clinical and physiological work, respectively. He, Collip, was kicked out yesterday, and I am in charge of making the dope." We'd like to call it the dope. "It means a lot of work, long hours, etc., but I hope to get it standardized before July." By September 1922, while there had been considerable progress with insulin production at Connaught and at Lilly, Best was preoccupied with further production challenges, not least of which was heavy rain flooding the lab's production area. By September 19th, after a couple of weeks of Best working in the lab every night and all day on Sunday, their problems had largely been resolved. According to 15-year-old Elizabeth Hughes, who had been receiving Connaught's insulin from Banting since she arriving in Toronto from Washington in mid-August, it was preferred to over Lilly's Ileton. "The stuff they are sending to Dr. Banting from the latter place, Lilly, is terribly weak in comparison to what Connaught Laboratory is putting out," she would write to her mum. Later, Banting took Elizabeth to visit Connaught, which was, as she told her mother, is in the basement of the medical building over at the university, where she saw extract made from the very first stages to the last. They are putting out such large quantities now that an enormous plant is running night and day with the men working in shifts, in relays. By November 11th, 1922, as Best reported to Connaught's director, Dr. John G. Fitzgerald, the lab was consistently producing about 1 liter of insulin each week, and the potency issue had been resolved. Connaught's production capacity had been helped significantly due to the new equipment made possible by a $10,000 gift by Mr. Bacon of New York City, who was a patient of a prominent diabetic specialist, Dr. Riley Galen, who had facilitated the gift through Banting. On August 25th, 1923, Banting and Best were the guests of honor at the official opening of the Canadian National Exhibition in Toronto, which is an annual fall fair in the city. Their presence was associated with a splendid insulin exhibit from the University of Toronto for the CNE's Science and International Year exhibit, or theme, sorry. The exhibit was quite detailed and illustrating the process of manufacturing the curative fluid, and included several of the original utensils used by Dr. Banting and Mr. Best in making their world-renowned discovery. In his opening address, Banting stated that, quote, "Canada's greatest monument is the Connaught Antitoxin Laboratory at the University of Toronto. Canada," he continued, "needs more such monuments so that scientists interested in pursuing problems in medical research do not have to leave the country." Best was one of those scientists who could have gone abroad to pursue his research interests, but he was quite content to remain at Connaught in charge of insulin production, especially in its newly expanded production facility. Best remained quiet during Banting's address at the CNE, and at the luncheon that preceded it. As the luncheon began, Banting called for Best, who had hidden himself among the guests, which included his father as well as Banting's father, to take his place next to him. Countering all the public attention he had received, Banting emphasized that the work on insulin was, quote, "not the product of any one man." He pointed out Best's assistance from the beginning, explaining how he had been in charge of the large-scale production of insulin at Connaught from its commencement. Best had been especially busy during August 1923, starting with a move into Connaught's refurbished YMCA building for insulin production. He'd also been traveling in the U.S. to help inspect the facilities of several pharmaceutical firms applying for insulin production licenses from the University of Toronto Insulin Committee. Best, moreover, was working towards completing medical school while directing Connaught's insulin production operations and serving as research associate for the Banting and Best Chair of Medical Research. In 1924, Best was also promoted to Assistant Director of Connaught Labs, and on September 4th, 1924, as this clipping highlights, married Margaret Mahone not long after Banting got married himself. Hence the title there, headline. By the end of 1924, ideas were also developing for Best to pursue new research opportunities elsewhere. 2 years earlier, Best had met Sir Henry Dale of Britain's Institute for Medical Research during a visit to Toronto to explore establishing insulin production in the United Kingdom. Dale had suggested to Best that after he completed his medical degree, he should leave the, quote, hothouse atmosphere of the insulin research to obtain fresh perspectives and broaden his experience in other areas of scientific research. In December 1924, Connaught's director, Dr. John Fitzgerald, helped Best earn a Rockefeller Fellowship to study abroad in London with Dale and then in Copenhagen with August Crowe, who had established insulin production there. However, Best had to first graduate from medical school, which he finally did in June 1925, at the top of his class. Best also had received a grant from the Connaught Research Fund to support him for 18 months. And on July 9th, Dr. Charles Best and Margaret Best left for London. He was anxious to get to work on anything except insulin. Indeed, during the late 20s and into the 30s, Best directed his scientific attention to other outstanding health challenges, most notably by leading Connaught's work in developing and producing heparin. Heparin provided a revolutionary biological tool for controlling blood coagulation, thus enabling the treatment of dangerous blood clots, making open heart surgery possible, as well as such life-saving technologies as kidney dialysis. And during the 30s, Best focused on physiological research and teaching, while his innovative research fueled further work on heparin and made possible the preparation and provision of dried blood serum for the treatment of shock and war casualties during World War II. Much more can be said about the work and long life of Charles Best. He outlived the other members of the Toronto Insulin team, passing away on March 31st, 1978, of a presumably ruptured aortic aneurysm, tragically a few days after the sudden death of his eldest son. Charles Best also had struggled with depression and survived an apparent suicide attempt in 1963. Best's passing ended a long period during which his historical perspective on the discovery of insulin story dominated the popular narrative. It often became self-serving, whether intentional or subconscious, and nurtured the Banting and Best myth, as we've talked about and Michael Bliss wrote about there. Best passing and the resulting opening up of the full archival record enabled Michael Bliss to systematically reconstruct the history of the discovery and development of insulin, which certainly included Best's essential role, especially in the successful production. Thank you.